Hi everyone, welcome to Toolkit Talks. My name is Jennifer Smith and I'm a Public Health Resilience Coordinator with CoCares, which is the Colorado Alliance for Resilient and Equitable Systems, as well as the Office of Public Health Practice, Planning and Local Partnerships here at CDPHE. Today we are doing the succession planning for local health departments, and this is video 2 of 3, so thank you for being here. So again, the toolkit is brought to us in part by Ohio State University Center for Public Health Practice in partnership with the National Association of County and City Health Officials, or NACHO. And so today our video structure, again, we've done 3 videos for this toolkit. The first one we did discuss the introduction to succession planning and what it is and making the case for it. And today's video is number 2, and we're going to be talking about the steps and phases of succession planning. And then video 3 will be the implementation, evaluation, and ensuring success of your succession planning. So again, if you already haven't done so, please click the QR code or scan the QR code to download the toolkit itself. We do recommend that you have kind of at least looked at that briefly before watching the videos. It might make a little bit more sense, or at least have that to do later. It's called the Succession Planning for Local Health Departments, Ensuring Talent Sustainability for Optimal Health Outcomes. And this is a course on the NACHO website where you do have to sign up, but I do recommend that because NACHO is a very useful website and a very useful organization. They have a ton of information on there available for you. So I would definitely recommend going and doing that. And you can take the course or you can just use the guidebook itself, which is what we're kind of basing these videos on. So today for video 2, our objectives are 1, to describe the steps, resources, and tools for building a successful succession plan. 2, identifying key positions for the succession plan. And 3, identifying competencies key for your local health department or local public health agency. 4, assessing the talent pool and establishing the pipeline. 5, access knowledge management. So let's get started. So, approaches to succession planning. There has been a significant amount of literature published on the concept of succession planning. We will deep dive into one general but comprehensive approach that includes steps that are highlighted across several models. So here you can see there are many phases of succession planning. So NACHO and the developers of this toolkit came up with these phases. So you can see there is a preparation phase where you need to understand what succession planning is and how it will benefit your agency. An alignment phase, align the goals of the succession plan with the strategic direction of the organization. I think there's a typo there. Analysis phase is where you're identifying those key positions and analyzing the existing talent pool. Strategy phase, you're developing succession planning strategies to address results from analysis and the metrics to evaluate success. Implementation phase, document the succession planning phases, which are preparation, alignment, analysis, and strategy, into a comprehensive plan, and then you're executing the plan. The evaluation phase, you're determining how well the plan is being executed and if the plan is meeting the desired needs of the organization. So let's get into some of these phases. So we're starting off in preparation, where I believe we sort of are right now, maybe even a pre-preparation phase. So 1 is to get to know the succession plan. 2 is building your succession planning team. And then 3 is preparing your team. So preparation step 1 is to get to know the succession planning. The informed leader. The person or persons leading the succession planning effort should Become fully informed about the succession planning process. Again, if you're not understanding what succession planning is, you're not understanding that process, you're not going to be able to lead the succession planning effort. Have a thorough understanding of the benefits to the organization. Speak with and learn from other local health departments or LPHAs that have implemented succession planning processes. It's always great to learn from others that have done this before you. So they have some suggestions for small agencies. As we know, we have a lot of small agencies across Colorado. Create an organizational or unit chart. Develop a timeline of retirement eligibility for key positions. Consider questions such as, when do you expect them to leave? Where do you expect to get replacements? Are replacements abundant and readily available? And if not, where will they come from? Identify those who are possible successors and discuss how they will be developed to compete. If feasible, work with HR to identify and build a relationship with successors. And as we know, a lot of these small health departments or small LPHAs across Colorado, you'll probably know all of those successors. So you'll be able to work with them pretty easily. Succession planning is a process that ensures two things. One, that organizational talent needs are identified and aligned with strategy and objectives. Two, key positions are identified and a pipeline of new leaders is developed. So here are some tips that they offer. Remember, if you are a small health department, you would not necessarily utilize an approach as robust as the one we will cover in this module. The information presented here outlines a process based on best practices. Do the activities that make the most sense for you and your health department. Capture essential information and key recommendations into your written succession plan. So again, this is not a one-size-fits-all, and they did the best that they can, kind of noticing that there are a lot of small health departments. So again, this is an outline, and you have to do what is best for your organization and what works for you and the amount of people you have working. Preparation step 2. Build your succession planning team. To successfully implement a succession plan, it may be important to develop a committee or a team to help with the succession planning. Smaller local health departments may not be able to assemble a team. However, the characteristics listed are important to consider for any person leading the succession planning effort. So here they outline some characteristics for a good succession planning team. If you have that ability to work with a team and to gather enough people to be a team. So they have characteristics and then they have meanings. So we'll just go through these real quick. So one characteristic is leadership and navigation. The ability to direct and contribute to initiatives and processes within the organization, as well as an understanding of how to navigate the organization. Ethical practice. The ability to integrate core values, integrity, and accountability throughout organizational practices. Business acumen. The ability to understand and apply organizational knowledge that will contribute to the succession plan. Managing relationships. The ability to manage interactions that will support succession plan development. Cultural awareness. The ability to value and consider the perspectives and backgrounds of all parties. Effective communication. The ability to effectively exchange information with partners and stakeholders. Critical evaluation. The ability to operate at a level of critical evaluation and interpret information and make business decisions and recommendations. Transformational, transactional effectiveness. Understands that soft skills are as important as technical skills and demonstrates effectiveness in both areas. So again, this is the characteristics for a good succession planning team, or if you're a small health department and it's one person, these are the characteristics that that person should understand and be aware of. Assistance with important processes. Lead and organize the succession planning effort. Delegate and monitor succession planning activities, tasks, and ownership. Develop the business case. Develop an appropriate approach to pipeline assessment. Analyze the workforce and pipeline data. Develop succession profiles. Write the succession plan. So again, assistance with important processes. For health departments who don't put together a robust team, the list of tasks noted here may still be helpful in understanding what activities may need to be simplified to work within the constraints of a smaller group. To fill voids, smaller agencies may consider reaching out to colleges of public health or even community members to assist with the tasks. If you at all are able to get interns, maybe from local colleges, local public health communities, or even community member volunteers, that would be fantastic as well if you are a part of a smaller community and smaller LPHA. And then this kind of shows the project management that's involved with the succession planning and an example of a spreadsheet that you can use. Due to the number of moving pieces this process entails, it's highly recommended that a project management role be incorporated into succession planning. So they're the person kind of keeping track of everything, right? What is the task? Who's responsible? When's the due date? What's the status of the task? And any comments, just to keep track of everything that's being done for the succession planning. And then if you can, they always recommend getting help from human resources. They can help you identify key personnel who can assist you. They can share your goals with the organization. They can get leaders involved in your planning process. They can identify, capture, and transfer required information to upcoming leaders and mission-critical practitioners. They can provide access to data related to future public health workforce needs. They can provide information regarding human capital trends and forecasts that impact the succession plan. And they can guide the team to any training and development opportunities to help prepare for succession plan development. Training and documentation. To help the team prepare, consider providing the following: this course or the reference guide from it, a preview of the forms or documents that need to be completed through the process, your organization's strategic plan, the mission and vision, values and goals especially, sample elements from completed succession plans and the succession plan template. And then your output is going to be the formal written succession plan. The findings and results determined during the alignment, analysis, and strategy phases of the succession planning process. The implementation and evaluation plans. So those are kind of all your written formal documents that will come from your succession plan. So next we're going into the alignment phase. So alignment steps. 1. Understand the strategic plan and the workforce plan. 2. Develop the business case. 3. Determine the budget for succession planning strategies. Alignment step 1. Understand the strategic and workforce plans. The strategic plan. The succession plan should be anchored on the overall organizational strategic plan. Strongly correlate the plan with anticipated challenges the agency may be facing and what talent is needed to successfully address them. Craft a succession plan that's aligned, effective, and reflects your culture. So this is all about aligning everything to things you're already doing. Alignment step 1. Understand the strategic and workforce plans questions to consider. So what is your organization's mission and vision? How would you describe the link between succession planning and the mission, vision, and values? What are your organization's strategic goals? What challenges or weaknesses is your organization facing that this may help to address? How would you describe the link between your strategic goals and succession planning? How will succession planning benefit your organization? For example, the retirement bubble, competition for talent, all of these things that can benefit. The workforce development plan. You should be able to answer these questions. What are your organization's workforce planning strategies? How would you describe the link between your workforce planning strategies and succession planning? What workforce data supports the business case for the succession planning goals? For example, a chart or narrative explaining that 62% of leaders, senior leaders, will retire within 5 years. And then workforce data. This data can be used to identify prioritized leadership skills and gaps, compare staff skills against organizational priorities. So workforce data really helps to prioritize. Alignment step 2, develop the business case. So what is the business case? Important part of articulating why the organization is pursuing succession planning presented in 1 to 2 paragraphs. So not a long, drawn-out thing, just a very simple, this is why we're doing this. So when you're developing the business case, they have some guiding questions here for you. What are your organization's strategic goals? What are your organization's workforce planning strategies? How would you describe the link between your strategic goals and succession planning? How would you describe the link between your workforce planning strategies and succession planning? How will succession planning benefit your organization? What is the workforce data that supports the business case for succession planning goals? Explaining, for instance, that 62% of your senior leaders are going to retire in 5 years. What are the succession planning goals? Examples of succession plan goals. To promote seamless staff transitions. To preserve legacy of achievements and experiences. To focus planning on critical vulnerabilities in the workforce. To build pools of talent capable of competing for essential positions. To encourage employee engagement, collaboration, and mentorship. Alignment step 3, determine the budget for succession planning strategies. Dual salaries. Ideally, there will be some overlap between the new leader starting and the outgoing executive leaving to allow for some mentorship and orientation. So see how, if you can do that, right? This is a line in the budget that you'll need to put in. Can we do dual salaries, even if it's for a week? Higher salaries. It is quite common to pay a new leader more than the outgoing leader. Hiring costs. Finding the right person to take over a top executive position may require the help of a recruiter or travel costs. Replacement costs. Despite your best efforts, you will likely need to replace some employees who decide to leave or are let go due to incompatibility with new leadership. Budget for these replacements even if you don't think you'll need it. So it's always good to just create a budget on its own for this succession planning and really see what those costs will be during the succession plan and to do this versus the costs of not doing that, right, which we discussed earlier. So the next phase is the analysis phase. Analysis steps. 1. Identify key positions for the succession plan. 2. Identify competencies key for your local health department or LPHA. 3. Assess the talent pool and establish the pipeline. 4. Assess knowledge management. Analysis phase questions. How are positions identified for succession planning? What positions have been identified for succession planning? What is or was the process for identifying the talent pool? What is or was the process for assessing the pipeline? What are the summarized results of the assessment? How was knowledge management assessed, and what are the summarized results? Who are the potential successors for each position? What is being done to develop them to compete? So what makes a position a key position? So they are incumbent or standalone positions. There is only one person who performs the unique position duties in the office. Key tasks. There are critical tasks that would halt or hamper vital functions that this person performs. They have a specialized or unique skill sets. These are positions that require specialized knowledge and or experience that is only acquired over time or through specialized education and training. Geographic challenges. If it is difficult for someone located elsewhere to carry out these functions, then that could be a key position. Difficult to retain or high turnover. A position or classification for which the agency has difficulty retaining employees due to factors such as environment, position stressors, knowledge drain, wage issues, or travel or other things, then that could be a key position. And retirement vulnerable. An employee will become eligible to retire within 5 years. That makes it a key position. Position inventory. So make sure you're taking inventory of each position. You need to know the unit, department, the position name, brief description of the position. Is it a single incumbent standalone? Is it difficult to retain? Difficult to replace? Is there a risk of attrition? Is it retirement vulnerable? Is it mission essential? Are there geographic challenges? Are there key tasks involved? Is it on a succession plan target? Yes or no? Knowledge management, plan priority rating, you can score these between 1 and 3, and we'll go into how they're just scoring. But what this is this is what should be on your spreadsheet for each position, right? You're filling in all this information so that you know if you're going to be targeting it for succession planning and what's the plan priority rating, right? How are we scoring it? So again, they talk about getting to know the 8 domains of the public health core competencies. These are really going to help you when you're rating and figuring out these positions. You can use that QR code there to get more information, but the domains are data analytics and assessment skills, policy development and program planning skills, communication skills, health equity skills, community partnership skills, public health sciences skills, management and finance skills, leadership and system thinking skills. So many skills here for these core competencies that can go into your succession planning. So here's where they're going through some core competency tiers, for instance. They give more information and a lot more in depth on this in the actual guidebook itself, but if you want to take a look here, this is sort of like they take all of those domains and they divide them into tiers. So for instance, the analytical assessment domain, the tier 1 would be frontline entry-level staff, right? They're doing the day-to-day tasks, they're not in management positions. They select comparable data and they use quantitative and qualitative data, but they don't do a whole lot with that. So then you have your tier 2, which is a program manager or a supervisor. They manage programs and or staff. They analyze the comparable data and they interpret the quantitative and qualitative data. And then you'll have the tier 3 in this domain, which is senior management, executive level. They are leading public health organizations and people. They evaluate the comparable data and they integrate findings from that quantitative and qualitative data into organizational plans and operations, right? So you have different levels here for that domain, and you're going to have these for all of the domains, so you'll know how to rate people. So then you're going to want to make sure you're assessing the talent pool and you're establishing the pipeline of people for these roles. So a talent pool is individuals who may succeed a current incumbent in a critical position and have indicated an interest in being considered for the position. The purpose of identifying a talent pool is really to define the employees and to be selected for development. And a talent pool can be determined by management or by the employees opting in response to an invitation or an announcement, or it can be a combination of both. And the graphic there kind of shows the both, right? So you have employees opting in, then you also have the management and the planners going, hey, these people would be really good in these roles. And so it's a combination of people in that talent pool. So again, you're going to assess the talent pool and establish the pipeline. So for management and succession planners, you're the ones to define the population of the talent pool. For example, the succession planning team may determine that the talent pool for senior executive positions is all direct reports to the executives. And then you'll have the employees opting in, and they want to be included in the talent pool. They're self-nominating to be considered for inclusion in the talent pool. And if an employee wants to be considered, he or she may self-nominate in response to an email, for instance, from management or the succession planning team, and say, I want to be considered for this role. And then you can have the combo, which I honestly think is the best option, where succession planners may determine that the talent pool population for a certain position is all employees within a specific grade level. And then a notification is released to invite employees within that group to express interest in the development for the position. So you can still control who gets that. So you can say this grade level are the people who are appropriate to be possible, succession plan people, but you're not going to avoid every employee, right? You're going to do everyone in that grade level, and then they can say, yes, I want to, or no, I don't. So next we have the analysis phase. So you're going to determine talent pool readiness. You're going to analyze all of this information. So determine the talent pool readiness. Determine the readiness of those who currently make up the talent pool in order to establish the pipeline. Right? So you're going to look at their ability, you're going to look at their aspiration, you're going to look at their engagement, and then in that middle section is your people, right? Those are your high potential employees. And you can see here just how they break down these bubbles here. So ability is your competencies, soft and technical. Your aspiration is your motivation to do what is required at the next level of responsibility. And then engagement is the commitment to the organization and its mission. So you have all of those things coming together, and then those people are going to be right in that middle there where everything connects. And it's recommended that ability, engagement, and aspiration are included when assessing talent for all positions. So tools to assess readiness. So how are you going to find if people are ready for these roles or not? So you can use tools such as questionnaires. It can be sent to the supervisors and or the employees to help assess readiness. You're going to look for indicators. So what indicators are important to your organization's success, right? What's important for you guys to look at? You can develop a 3-point scale, such as theirs here, which is pretty simple. 1, needs improvement, 2, competent, and then 3, expert. So these are some questions. Again, we're only going to go through a few of these. There's more in the guidebook, if you which, hopefully you can look at that and get some more examples and information. But for instance, so you have an indicator and then you have example questions of what to ask, right? So for some indicators, right? So engagement. Does the employee ... work with others in varying perspectives to identify solutions and test theories? Does the employee connect to the success of the organization and his or her team? Does the employee set a high bar for excellence and motivate his or her team to exceed expectations? Does the employee demonstrate a positive attitude about the organization and career trajectory within the organization? So again, does the employee for aspiration, does the employee aim to assume more responsibility? Does the employee demonstrate a willingness to take risks and make difficult decisions? Does the employee strive to make an impact within and outside the organization? Does the employee display initiative to take on responsibilities outside of his or her own role? And again, for engagement, does the employee work with others in varying perspectives to identify solutions and test theories? Does the employee connect to the success of the organization and his or her team? Does the employee set a high bar for excellence and motivate his or her team to exceed expectations? Does the employee demonstrate a positive attitude about the organization and career trajectory within the organization? So great questions to start asking and assessing these skills for these potential successors. And they have a sort of matrix here, so what you can do, you can create your own, you can use something like this. So as you can see in this example here, they have, just high performing specialist, adaptable high performer, top talent, solid performer, valuable performer, future star, low performer, inconsistent performer, and diamond in the rough. So they kind of have all different ways to kind of work this out here. So so on the left you'll see the performance track record, and on the bottom you'll see the potential for more to advance, broaden career. And not only is this going to help you with succession planning, but this is really going to help you, I think, just know your workforce and know where you need to lead people and train them and develop them. So that top row there, you can see always meets and mostly exceeds expectations. The second row consistently meets expectations and may exceed a few. And then the bottom row is where they have trouble keeping up or not meeting expectations. And they're based on performance review results, as you can see with their little dots there. So the 1 asterisk and then the 2 asterisks is high potential. And then on the bottom there, so the columns, the first column is specialized or expert talent and may have reached career potential. The middle column could be promoted 1 or more levels in career or lateral move with greater scope or challenge. And then the right column, the blue column, demonstrates high potential to advance further, perhaps 1 to 2 levels in 3 to 5 years. So again, you can see that this will help not only with succession planning, but also I think in developing your workforce and seeing where people want to go versus where they should be going and where you can develop them further. So again, these are some of their performance matrix examples. You can find more on that in the guidebook, of course. So a high performing specialist is consistently exceeding expectations in their current role. They have a narrow or niche perspective. Solid general manager with strong results at their level. An adaptable high performer is someone who demonstrates leadership within and outside of their own area, has yet to hit the ceiling on their potential. And then again, just continuing some examples here, a valuable performer sees the bigger picture and acts with it in mind. thinks beyond the day-to-day. A low performer is not meeting current role expectations, expresses little desire to improve. And then a diamond in the rough is demonstrating clear capability to handle more complex and ambiguous activities. They're a strong, quick learner, but may translate that to business results. So again, these are just some great examples of how to work that matrix and what these things mean. So data and criteria. So we're always relying on data in public health. So we want to compile the data collected from all individuals in the talent pool to produce averages for each indicator you select. Each position should have a rating sheet to give you a snapshot of its overall succession readiness. It is important to understand the overall picture of the talent pool to determine who should be considered part of the current pipeline and to determine the next steps, including training, development, recruitment, and retention efforts. Data and criteria continued here. So those who scored a 1, which is the needs improvement on certain indicators, the planning team should notify supervisors and the employee that at this time significant development is needed for them to be included in the succession plan with recommendations for development opportunities. And just make sure that you are doing this. Again, I think they talk about discreetly, one-on-one, and make sure you give them development opportunities. I think it's okay if you're saying you're not really qualified right now, but here's what you can do and here's what we're going to give you, rather than just saying, okay, you need to improve without giving them any content on that, any like actionable items that they can take with them. It will be important for supervisors to have direct discussions with those that opted in about why they are not included in the succession pool. So really make sure that this is a development opportunity still for them, even if they don't qualify, so that they don't take this negatively and they are able to go, okay, well, this is where I need to improve. These are the qualifications that I didn't meet, and here's how to get those qualifications. And so discuss gaps, training and development to focus on with them. And then for the people who score 2 or 3, competent or expert, may have a notification sent to their supervisor that their career development plan should include specific development opportunities and development activities to prepare them to compete for the position should it become available. So again, succession planning is not exactly when somebody's leaving, right? So this person may not be leaving for a couple years, but we're saying you expressed interest in this position now that we're starting this succession planning development, and so here's how to develop for that position once it does become available. It's not immediately available, right? So we're not giving people, okay, we're going to put you into, the interviewing process for this. We're just saying, in the future, this is what you can do if you're interested in this position. This is how to get there. So then you need to assess your knowledge management. So collect and manage the knowledge from your different positions and your different employees. This is going to allow organizations to, 1, capture and preserve the knowledge and work experiences of individuals in key positions. So you'll have that when somebody leaves. You don't have to rush and try to get that information from them. You'll already have it and be able to share it with the new people pretty much immediately. 2, support the continuity of the work when those positions are vacated, right? So nobody's leaving and leaving things that are unfinished. It will just continue on with the next person because you've already planned that. 3, establish processes and resources that support centralized documentation and retention. So here are some key questions to assess knowledge management. Is there unique knowledge inherent to the success of this position? If so, please describe. Does anyone else have this knowledge in the organization? If so, who? How critical is it that this knowledge is documented and shared? What are the critical ongoing projects for this position? Where is the associated documentation and status reporting kept? Of the key meetings and committees and working groups that you attend, which are the most critical for achieving success in your position? What are some of the most important lessons you have learned in your time in this position? What are some of the key issues and challenges faced in accomplishing the work? What changes would you recommend? I wish I could. What? Great questions. Please, I would add all of these to your knowledge management of positions because these are great questions. So next we're going to talk about the strategy phase. So strategy steps. You want to develop knowledge management strategies. You want to develop training, development, and recruiting plans. You want to develop succession profiles. You want to determine what metrics will be used to measure success. So questions to ask during the strategy phase. What knowledge management strategies will be employed? What training and development strategies will be used, such as job rotations, leadership training, special assignments, coaching, mentoring, shadowing, or learning groups? What are the strategies for knowledge transfer? When and how will you measure success? Consider the method and the time frame. Develop knowledge management strategies. So determine how succession planners will address gaps in documentation of policies and processes related to the position, design a repository for position-related documentation, develop knowledge and information sharing process. So some examples: process best practices, policy and rule documentation, videos and work diaries, job aids, job rotation, job shadowing, and hiring new people before the old one leaves. Develop succession profiles. So capture the required competencies and the readiness of the current workforce. It assists in the process of assessing and developing staff for leadership and other key positions. Make sure they are succinct and help with the organization's leaders to understand the succession planning efforts. They should be created for positions from first level supervisor to the top executives of the organization. Make sure they capture information on positions and not on individual employees. Include strategies from the workforce development plan. Include portions that can be filled out by each incumbent for their own position. Outline readiness of the talent pool and strategies to identify and develop pools. Determine metrics. Qualitative objectives can be based on developing leadership competencies such as communication and decision-making skills. A quantitative measure might be the number of vacancies filled from the talent pool compared to the number filled from the outside. Key performance indicators aligned with succession planning will cascade from the key performance measurements associated with each succession planned role and the higher level measurements to which they are attached. A measurement of success is the performance in the new role. This would indicate whether development activities and knowledge management efforts were successful. Okay, so that is all of video 2 for today. That was a lot of information that we just went through. So I would make sure that you watch this maybe a second time. Make sure you've reviewed the guidebook, as everything we've taken is from the toolkit or the guidebook. So make sure you're going to the NACHA website and you're downloading that, or you're doing their little course in there just to get more information. Again, a lot of what we have in the course is more of a summary. We didn't put everything in here because it's just too much. So again, anything you need can also be found on their website. So make sure to connect with us using the QR code if you'd like to get in touch or get to our website. Our email is ophp@state.co.us, so please feel free to get in touch if you have questions. And check out our Who Works in a Local Public Health Agency training. It's on cotrain.org. The course ID is 1121182. Again, this is going over the job descriptions model, which has a lot of information of just the different job descriptions and information that we use across Colorado. It's not everything that we use. We all have different job titles and different things just depending on where we are in the state, but it really gives some really good information to go by when you're trying to start figuring out these roles and the different positions, so that can be really helpful. So again, please, thank you so much for watching this. I hope you enjoyed it. Our next video is video 3, and we're going to be kind of delving into the rest of the succession planning and through the end of it. And thank you so much for being here. Take care. Bye-bye.